My name is Denise Zambezi and I am working for Access Chapter 2. I work as the legal coordinator and researcher, and I am also the project coordinator for certain projects I'm the project coordinator for certain projects that we have, including the transgender project called Amatawe. And we also have a project for young women and girls as well, specifically in Attridgeville, more like in township areas. That's the aim. The focus is it's research. We do some advocacy work. We have safe spaces and social spaces for transgender people. The research aspect of it, we conducted a survey last year for transgender women specifically who are residing in Gauteng. So it included things like the access to health, access to legal services, and access to employment. So it was like a sort of holistic study of the lives of transgender women in South Africa. And the safe spaces, we have them about once every single month, where we bring together transgender people from Pretoria. We have two of them. We have a Pretoria-based safe space, and then we've got a Johannesburg-based safe space, where we bring transgender women together. During the safe spaces, we normally have like themes, different topics, access, sexuality, gender identity. So the transgender women, they get to participate, and a lot of them, they like that space because they get to meet other transgender people and they get to learn, and they also become more aware of the different facilities they can go to in order to access their health and administrative justice needs. With trans women, the main challenge is health, because most of them, they want to look like the gender that they identify themselves as. So they want hormonal treatment, and they also want access to gender reassignment surgery, for instance. So with regard to hormonal treatment, a lot of the transgender women that I've spoken to, they feel as if there are not enough health facilities that are offering that. And for instance, I think there are only 2 hospitals that are offering that, including Steve Biko, I think, is one of them in Gauteng. So with regard to that, since there is limited access, most of them are on birth control, and they get them like from the black market type of things, and it's not really advisable for trans women to take birth control. And a lot of them, since they self-medicate, they tend to overdose of it. Like they tend to take a lot because they want fast results. They want, the changes to happen faster. So they will take more than you even should. In one case, I think one trans woman, she said she got like really bad headaches after doing that. But despite that, she was willing to do it again because she said the changes were so fast, and yeah, that's what she wanted, because she wants to feel comfortable in her skin. She wants to look like the gender, like I said, that she identifies herself with. Yeah. The most common ones, it is stigma and discrimination and hate speech. Even in the health center, a lot of LGBTI people are afraid of secondary victimization from healthcare workers. So for them, I think, they're less likely to approach health centers that do not have sensitized staff who do not know what LGBTI, who do not know how to speak and approach or deal with LGBTI people. There was a specific case as well with a transgender woman, for example, where she went to a clinic, and she informed the healthcare worker that she had unprotected sex. So sorry for laughing. But she informed the healthcare worker that she had unprotected sex, and the healthcare worker gave her like the morning after pill instead of like prescribing PEP, because they didn't really know exactly that she was transgender, and they were not sensitized, and they didn't ask the right questions as well regarding her gender identity. So those are some of the problems. But with regards to the legal aspect, it would be secondary victimization that makes people not go to hospitals. LGBTI people not go to hospitals. I think sensitization is very important because there's still a lot of people in South Africa who really don't know much about LGBTI, and there's still a lot of stigma and discrimination. So the sensitization aspect is important, and I think it's very good to know the people that you are catering for, basically.